This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center, and I'm going to discuss ketamine therapy overviews, and I'm going to discuss ketamine therapy from front end, and why would you want to do ketamine therapy to begin with, and how it can help the average individual with treatment-resistant depression and a number of other mood disorders. So we know that mental health disorders, especially depression, is going to be the number one cause of disability by 2030. Some 21 million adults in the United States had at least one major depressive episode, and this represents about 8.5% of all U.S. adults. And the prevalence of depressive episodes were higher in adult females versus males by 10% to 6%. And the average annual prevalence of treatment-resistant depression is somewhere around 31% among adults with medication-treated major depressive disorder. And that represents about 2.8 million adults, or 1.1% of the U.S. population. Now, suicide rates continue to rise, and really the treatments that have been available have been used for over 50 years. Now, what's been recognized is that more recently, the glutamate system is a key learning system and memory system, and it's also an important system that sculpts the tone of serotonin and dopamine. And for many years, it has been felt that serotonin and dopamine are the major mediators of all our mood and effectively all mood disorders. But glutamate is a higher system, and it is actually about 60% of the cortical neurotransmitter load. And this is a really critical neurotransmitter in terms of what it does for mammals. And ketamine actually modulates the glutamate system. And that's one of the reasons why ketamine works so well. None of the other available treatments effectively modulate that system. So we know that antidepressants, when taken, take a long time to work when they do work. And we know that from the STAR*D trial that effectively the time to response could be 2 months. So, and the whole response thing is basically 50% improvement in depression scoring, not remission. And that also the remission rates for patients gets worse and worse with each failed trial of medications. So with the STAR*D trial, initially they started with one type of antidepressant, and if that didn't work, they switched to another one and then another one. And with each subsequent step of failure, the chances of there being treatment success were less and less. So by the time a person gets to their third treatment trial of, let's say, an SSRI, the chance of there being a response is probably less than 10%. And the other problem with antidepressants are they have side effects, many side effects. In fact, weight gain is one, and anhedonia, which is emotional numbing. And people just kind of feel like a zombie. They just don't feel anything in the world. And that actually increases their risk of bad outcomes and treatment non-response, as well as suicidal ideation. Then there's also sexual side effects, loss of sex drive. The other issues are antidepressants work slowly if they work at all. So by the time you figure out it didn't work, 2 months has gone by. And if you don't see any effect at all, then it's time to switch to another one. By that time, you've lost your job, you've lost your fulfillment, you're just generally unhappy, and then you also accrue other medical issues too. The other problem with traditional antidepressants is they don't necessarily clear up fatigue and brain fog and low motivation, and they don't increase wellness factors such as low self-esteem, ruminations, happiness, or hope. And as I just mentioned, there's also the increased risk of medical complications over time in poorly treated depression, such as heart attack, stroke, and early death. And so the key points of what we lose with depression are your brain is aging faster. Your brain is also scarring. You get cognitive scarring. You lose cognitive abilities. You lose verbal ability. And you're also losing the opportunities for good quality of life and fulfillment. And you're also increasing your risk of dying by heart attack, stroke, and diabetes, and even addiction, with a 5 to 10-year loss of lifespan due to metabolic complications from depression. And that's not from suicide. And of course, then there's always suicide also. And that takes a certain percentage of patients who suffer from mood disorders as well. And the key problems with depression that typical treatments fail again are brain fog, motivation, fatigue, anxiety, ruminations, anhedonia, which is no mood or no excitement in life, and negative self-talk, low self-esteem, and insomnia. And so these aren't really treated by typical antidepressants. And we have to recognize that depression is neurodegenerative. Mood disorders are associated with brain shrinkage in key areas of the brain. There's a loss of neurons, loss of synapses, loss of neural connections, and then there's loss of resilience and adaptability. And then, of course, the brain fog and low attention and concentration, poor working memory, and cognitive loss that follows. And this results in poor decision making, in impulse control problems, and executive functioning disorders as well. Agitation, irritability, the list goes on. And we know from studies that areas of the brain do actually shrink with depression. Hippocampal volume, for example, correlates with the duration of untreated depression based on specific studies. And also that further studies demonstrate regional brain volume loss in depression and anxiety disorders. And this robs us of cognition, happiness, and functionality. We lose the ability to make good decisions, and we lose jobs and money in our families as we sink deeper into mental despair. And depression also increases brain aging. And it's been shown in studies that effectively there's changes in our sirtuins, which are involved with deep metabolic processes that effectively result in synaptic loss, inflammation, alterations in neurotransmitters, and increased aging in our brain. There's also cognitive scarring, which people don't really recognize, is that basically we lose specific areas of cognition, such as visuospatial processing and working memory, such as the ability to remember a phone number on the fly, or even verbal memory. One study by Gorwood and his colleagues in 2008 demonstrated that depressive episodes are neurotoxic and that there is cognitive scarring with a loss of approximately 2% of delayed recall capacities for each episode of depression that gets worse and worse. And this actually occurs even in between episodes of depression, reflecting cognitive scarring. And then there's loss of work functioning as well associated with depression. So we know that people who are depressed or even recovering, they lose energy, motivation, they get physically slow and daytime sleepiness. And as a result of this, many people who get treated for depression may be less depressed, but they just can't get back to work because they can't think. And this represents about 52% of patients that have cognitive difficulty, and that interferes severely with their work functioning. So we live in an age of cognitive capital. So you notice that if you're losing memory or difficulty with your working memory and decision making and this visuospatial processing, that you just can't get your job done. And we need every IQ point to maintain our cognitive intensive jobs. And so brain fog, which is associated with depression, is really important to work out and to improve. And fatigue and low motivation are also crippling. So antidepressants that we use traditionally may make us less sad and less tearful, but we just don't get hope. We don't feel optimistic about the next great adventure. We have anhedonia, and they basically emotionally blunt us. So we just kind of exist. And really what we need is mental wellness, mental health wellness with hope and happiness and increased self-esteem and fewer ruminations, more motivation, better sleep, less negative self-talk and self-sabotaging behavior, and less anxiety. But traditional antidepressants just aren't providing that for us. So when you can't get out of bed and brush your teeth or comb your hair, effectively, depression has taken a huge toll. It's robbed us of motivation and delayed discounting. It basically damages key areas of our brain that tell us, hey, getting out of bed does actually make a difference. It is rewarding, but not instantly, because then you get to go to work and make some money and enjoy a movie later on today. But we begin to think with deeper areas of our brain, the more depressed we get. We don't really think of the rewards that we can get by brushing our teeth because there's nothing motivating about that. So when you're really depressed, you start to think more like a lizard about just immediate rewards. And it has to be really rewarding for you to want to get things done. And that's one of the key problems with depression and mood disorders. So we know cognitive symptoms are common in depression. Cognitive losses are demonstrated in numerous studies. And this cognitive loss continues even between depressive episodes. So this continues to rob people of their absolute fulfillment in life. And then there's issues with hot and cold cognition, which basically cold cognition would be the ability to maybe take 100 minus 7, which is 93, and do that again and again. When people get really depressed, they have a hard time focusing on that. And there's nothing emotional about that kind of math. But hot cognitive areas involve the ability to, for example, assess an individual's mental state, or if you see somebody, are they happy, sad, or making decisions such as, if I tell you that there is a 99% chance that this treatment will cure your cancer, but a 0.0001% chance that it may turn your hair green, an individual who's been suffering from mood disorders and depression may, because of hot cognitive deficits, say, I'm not taking that chance of having my hair turn green, even though that treatment may actually help their cancer. And likewise, it's difficult for people with hot cognitive deficits to also recognize when they are improving with the treatment. They have low self-awareness. And so they have basically more difficulty with negative feedback. They have impaired performance on regular, even cold cognitive tasks that are just requiring calm decision making. So effectively, a number of different cognitive aspects are affected with depression. And then we also mentioned earlier about the loss of lifespan, the 5 to 10 years loss of life from heart attack and stroke and diabetes, because there's a bidirectional flow of depression to our periphery with changes in things such as insulin cycling. And as a result of that, we also get increased inflammation in our general body and increased risk of metabolic complications. And of course, there's always the suicide risk. So what's really going on with our brain is that stress produces neuronal atrophy, and we lose effectively dendrites. We lose these small little tiny knobs that come off of these axons where they reach out. And these are involved with effectively the maintenance of synapses. And so as an individual goes through chronic stress, they lose a number of these dendritic spines so that their neurons are less fuzzy and make less connections. And so we get fewer dendritic arborizations, fewer synaptic spines, and a lot of these neurons will start to retract and separate from each other. And a lot of this is due to glutamate dysregulation in the cerebral cortex. And this glutamate can be in excess or not quite enough, and we get changes in the way that glutamate interacts with specific receptors in the brain, in particular the NMDA receptor, which is one of the key receptors that glutamate turns on. And what's important about this is glutamate is important in learning and also in pain responses. So stress leads to effectively loss of dendritic spines. And this loss of dendritic spines is what ultimately causes our brain to lose connectivities, because these little tiny spines meet up with other terminals of other neurons to create synapses. And loss of those spines results in loss of synapses. And that begins to be a problem, because then we lose neurons, we lose support structures, and brain volume shrinkage occurs. So we know that stress with the brain causes basically loss of these dendritic spines. And this is an example of this from a study where they showed that with chronic stress in rat neurons that there was loss of dendritic spines that is returned after ketamine infusions. And we'll discuss more about that here shortly. So that brings us to, what is ketamine? Now, we all have heard of ketamine, special K. It's been identified as a party drug by the general layperson, and it certainly has been used in the party atmosphere. And ketamine has wrongly been branded as horse tranquilizer, and it makes it sound way too powerful for human consumption. But in fact, ketamine is extremely safe, and it's used in much smaller doses with humans. It's been used for anesthesia purposes since 1970. The drug is one of the safest drugs on the planet, and it's been in use for over 50 years. It's been used in the medical arena. It's associated with very excellent cardiovascular stability profiles and respiratory profiles. In fact, it's on the World Health Organization's essential medication list since 1985 because of its safety and efficacy and anesthetic purposes. And so the history of ketamine is fairly lengthy and complex. It actually is a related drug to phencyclidine, or PCP, which was created in 1956. But unfortunately, PCP was just a little bit difficult to control from an anesthetic purpose. And in 1962, Carl Stevens produced effectively ketamine, which was then tested on actually volunteer prisoners in Michigan by Dr. Domino and Dr. Corson. And these individuals basically felt they were floating in space and that they had no feelings in their limbs. And effectively, they named ketamine a dissociative anesthetic, meaning it separates your consciousness from your ability to feel things. And ketamine at that point was starting to be used in the veterinarian arena, but by 1970, it was actually starting to be used in anesthetic purposes because it was FDA approved at that point in time. So the basic timeline of this is the 1962, ketamine was discovered. It was FDA approved for anesthesia in 1970. And in 1985, the World Health Organization placed ketamine on its essential medication list due to its efficacy and safety in anesthesia. You could literally just give a person an injection and walk away from them. And then in 2000, the first clinical trial that was published was by Dr. Berman and Crystal using ketamine infusions on patients with treatment-resistant depression. And it showed that 70% of patients had an immediate response with one infusion with significant improvement or remission of their depression. In 2019, ketamine was approved as Spravato, which is just S-ketamine, and that was in-office use for treatment-resistant depression. Now, ketamine has an extensive timeline. It's been used for numerous years in numerous studies all over the world in different contexts. And this timeline demonstrates that even shortly after ketamine was discovered, that in 1972 in Iran, a gentleman named Khorramzadeh and Lofty in Iran actually were using ketamine in psychiatric purposes for depression as a abreactive agent to help individuals deal with mood disorders. It was also evaluated in 1974 by Fontana and Laschi for its antidepressant effect. And even in the 1970s by Salvador Roque of Mexico fame, where he used ketamine therapies in subanesthetic doses as a form of psychosynthesis with other drugs as well. And 1975, there were studies evaluating ketamine as well for its antidepressant activity. And even Krupitsky in Russia in 1985 used ketamine in a form of psychedelic psychotherapy for alcohol use disorder. So what exactly is ketamine? Well, ketamine is effectively a right-handed form and a left-handed form of these structures right here. And when you receive IV ketamine or ketamine of any general nature, if the FDA approved ketamine, you're going to get right-handed and left-handed forms, which is effectively mirror images of each other. So every chemical structure which has more than 3 sides to it will effectively have a mirror image, and our body prefers one side over the other typically. And so ketamine has a right-sided and a left-sided version. Now S-ketamine is the one that's called Spravato, but R and S-ketamine, right and left-handed ketamine, is what we're giving when we give IV ketamine or home-based ketamines. It's a 50-50 mixture. Now right-sided ketamine appears to be very potent and long-lasting and very safe with fewer psychedelic properties. And it also has fewer side effects. The S side does also have antidepressant effects, but is also more psychedelic in its use. And also it is a little bit more powerful in terms of the way that it dissociates people. However, again, the 50-50 mixture through an IV is found to be much more efficacious than actually Spravato. So how does ketamine work? Ketamine is a glutamatergic agent, and it's an NMDA blocking agent. It effectively causes alterations in the glutamate system, is the way I should put that. And by causing a brief glutamate burst, it causes eventually the release of brain-derived neurotrophic factor, which is effectively fertilizer for the brain. And this BDNF actually activates mTOR, which is a protein-producing agent in neurons. And this resulting protein production causes the formation of new dendrites, which results in new synapses. And this is a term which is called neuroplasticity, which is the key to any healthy brain. And so new synapses repair neural networks. It allows us to learn and have better cognition and improve motivation. And also ketamine decreases activity of the default mode network, which we will discuss in some other video. This also enhances our cognitive performance by basically putting us in a more mindful present state. And there are other effects that ketamine has as well, but overall, the effect that ketamine has in the neuron and in its synapses are actually quite complex, and they're certainly being teased out at this very time. And there's certainly still a lot of work to do as far as figuring out exactly how ketamine works, but effectively, ketamine does cause NMDA receptor antagonism, which is a key receptor in the brain, in the mammal's cortex, and it effectively turns off these GABA interneurons, which allows this glutamate burst. And these GABA interneurons basically quiet down key cortical areas of your brain from overfiring. And so effectively, this glutamate burst activates specific AMPA receptors, which cause the entry of specific ions into the postsynaptic neuron, resulting in the release of brain-derived neurotrophic factor. BDNF effectively interacts with specific tyrosine kinase B receptors on this postsynaptic membrane, ultimately activating mTOR, which produces synaptic proteins. There are several types that are produced, and these proteins are involved with the productions of synapses through dendrite formation. So effectively, we have these small little dendritic knobs, which are few in number when the neuron is stressed, and they increase as a result of a ketamine infusion. And these little knobs then allow the formation of another spine to meet with this and form a new synapse. And the creation of new synapses is something that our brain likes to do. It makes us feel better. So effectively, we know that ketamine has been used for mood disorders, but the question is, with most individuals, is, what do we use ketamine for? What treatments does ketamine offer availability for? And so the question is, do you have a condition that's treatable with ketamine therapy? And the things that we use ketamine for that's been found to be effective, and we'll go through this a little bit later in the presentation, are things such as treatment-resistant depression, or even new onset depression, post-traumatic stress disorder, anxiety, anhedonia. Ketamine is one of the few treatments for anhedonia, obsessive compulsive disorder, bipolar depression, postpartum depression, headache disorders, chronic pain, CRPS, phantom limb pain, neuropathies, and addiction disorders. So the other question when you're deciding about whether or not you want to get ketamine therapies are, do you have conditions not treated by ketamine? These would include things like personality disorders or a toxic environment. So if you don't like your spouse or your job, then it's not going to really change with ketamine therapies. Ketamine therapy can certainly give you increased resilience and psychological flexibility, but it will not change your job. It won't change anything around you. Ketamine is also not generally used in patients with schizophrenia, patients with negative attitudes or fixed beliefs. It doesn't change those. It won't change your personality. So I can't make you like green if you like red. And it doesn't work on nociceptive pain, like if you have knee pain or just low back pain. It doesn't work well for that on a long-term basis. And of course, if you have multiple medical conditions, anything like heart disease or stroke or uncontrolled diabetes or kidney or liver failure, then you would need to have medical clearance. And of course, pregnancy being the other one as well. We wouldn't use ketamine therapies during pregnancy. And in order for an individual to really go through the ketamine process, you have to recognize the limitations of ketamine therapy. So basically, for treatment-resistant depression, 70% of patients will have response or remission, but it's a treatment, not a cure. So again, we discussed that depression is a neurodegenerative disorder. It tends to get worse over time. And if it's poorly treated, it will continue to get worse or it will recur. So even in the STAR*D trial, it was recognized that 50% of patients who achieved remission with depression treatment actually got depressed again a year later. So even with traditional antidepressants, you will have to continue preventing the relapse of depression. And so ketamine therapy requires follow-up treatments. It requires booster infusions. And you may need to continue your regular antidepressants or have them adjusted. So recognize that you might not necessarily just get off all your antidepressants and onto ketamine. You also need to incorporate lifestyle changes such as diet, exercise, sleep regulation, and stress reduction. And of course, addiction treatment is needed, as well as continued psychotherapy, which is really important for the individual to kind of fix behaviors that they've accrued because of their mood disorder. So how is the ketamine administered? Well, the fastest and most effective way is by infusion through an IV. Generally 6 infusions over 2 weeks, usually 2 to 3 times per week, non-consecutively is what we do. And each infusion lasts 40 minutes. The dosing is between 0.5 to 0.75 milligrams ideal body weight over 40 minutes. And we use escalating doses as needed for effectiveness. Dissociation is not needed to achieve effect, so you don't have to go into outer space to make ketamine work. And there's also a number of studies that demonstrate that dissociation is not associated with outcomes, but some people do feel better when they dissociate. So there are individuals where we do go higher to basically achieve that ego death that seems to make some people better. Now, for most individuals, they're able to work the next day after the infusion. And in our office, we generally have long hours on the infusion days so that individuals can work that day, come in, get their infusion, and then work the next day. And the other thing is that as far as what the ketamine infusions feel like, most people find the initial infusion to be relaxing, calming, or immersive. But some people do get a little bit of anxiety, and that can certainly be controlled by controlling the drip rate. So, as far as the way that Nova Health Recovery has its treatment process, we take a look at the condition. And so, is the condition treatable with ketamine? Does the individual have one of these situations, such as adolescent depression? And we do use ketamine therapies for patients as young as 14. Also, suicidal ideation, PTSD, anxiety, depression, as we already mentioned, some of these. And then, are you medically able to receive the treatment? So, we look at medical complications that the individual has, make decisions on safety. And again, ketamine is extremely safe. It does allow the individual to achieve relatively stable blood pressures and respirations with the dosing, because we are using sub-anesthetic dosing, meaning low doses, not anesthetic dosing. And then we do a medical intake, mental health preparation session, like an integration session, to take a look at the person's mental health journey and evaluate, what directions the individual has gone and what situations they've gone through, what medications they've tried. We discuss the treatment risks, benefits, expectations, and follow-up treatments. And we discuss, how ketamine works and the neurobiology of your condition and integrative options for lifestyle changes and other even medications that may be helpful to treat your disorder. We look at addiction concerns, we address obesity, because those all impact actually results. Obesity actually decreases the efficacy of your traditional medications, and it also increases the risk of recurrence of depression if it's not treated appropriately. And then, as we discussed, we have the ketamine initial infusion, which is, if it's appropriate, it's given over 40 minutes, 2 to 3 times per week, and you don't want to go more than several days between infusions. Most will have 6 infusions or more. And the other aspect is that you need somebody to drive you home. You can't drive after you get a ketamine infusion for several hours. And then there's the aftercare part. So people will need to get boosters and even home therapy. So at Nova Health, we provide home-based oral ketamine therapies and nasal spray therapies. And those are not Spravato. It's R and S ketamine that's compounded, given in a prescriptive manner that is non-dissociative and microdose. So the individual is not going to feel anything, but rather it's just used a few days a week in the context of a home use. And it's, again, a very safe and non-palpable type of experience. The individual should also continue their psychotherapy, and individuals can certainly do integration sessions in the office, even sessions during their ketamine session. But most individuals prefer to be alone. They prefer not to have somebody with them during their session, because this is an inward experience. And the integration is more important, but can be done the next day or the next couple of days, where they meet with a therapist after they've journaled their experience and discuss what the experience was like and what difficulties they might have had during the infusion as far as what they felt or the great things that they felt. And then there's the periodic boosters. Most people will do boosters on a monthly basis for several months or as needed or even more frequently. And we also monitor for lifestyle changes and also self-awareness of individuals. In other words, most individuals sometimes have difficulty monitoring when they're getting worse or better. And so we have medically validated scoring systems that we follow individuals along with, as well as periodic check-ins. And so just in general, obviously the ketamine works best through IV routes because it's 100% bioavailable, and it's given in a drip rate over a set period of time that's completely controlled. And this is what a typical infusion room looks like. It's more or less kind of a home-like atmosphere. We generally use galaxy lighting, and music, which individuals can certainly bring their own headsets in to listen to their own or into our music that is curated. And the individual just kind of relaxes back and it does the experience. Everything is monitored and it's done in a non-intrusive fashion. And these are a number of different rooms that are available at Nova Health as examples. So the one question always comes up about ketamine use in ketamine on the street is as far as Special K. And there is a difference between ketamine effects with depressed versus non-depressed people. And so ketamine, when used in depressed patients, is done in sub-anesthetic dosing, meaning it's not anesthetic, it's low dose and it's given in a drip fashion and it's medically controlled. But when used on the street, individuals are generally partying with it and they will use it in high doses, which is actually anesthetic dosing generally. And a lot of times it's debased with other substances such as fentanyl or MDMA or even cardizem or whatever else the individual has received from the person providing it. So the substance they're getting might not necessarily be pure ketamine. And we just want to kind of point that out because, again, a lot of individuals wonder, oh, they could just use ketamine off the street for this type of treatment. But the reality is, no, there's a totally different phenomenon with ketamine that's obtained off the street. It might not be what you think it is. And also the way that it's administered and its dosing does not work the same as a drip or in specific dosing patterns. But likewise, if an individual is not depressed and takes ketamine, it feels effectively more like an alcoholic drink with an alcoholic drink being on steroids effectively. And it has a distinct effect on the brain versus somebody who's actually got depression or mood disorders. So what is the ketamine infusion experience? Well, it's important if you're coming in for the infusion to bring comfortable clothing and spare clothing because sometimes you can have vomiting, and we generally give prophylactic medications to prevent that. And that occurs in about 5% of patients if they don't take something to prevent it. And so you certainly want to be comfortable during your infusion, and you want to bring maybe a weighted blanket or your favorite blanket, eye shades if needed. A lot of people do prefer the experience with their eyes open, and bring noise-canceling headsets with ambient music. You definitely need a driver who can stay with you during the whole infusion. You want to clear your agenda and kind of enter your safe zone and maybe think of a particular problem or intention that you want to confront during the infusion, but don't expect any particular experience. Effectively, the infusion experience is more like a lazy river of thoughts, and so don't feel upset if you don't accomplish any particular agenda. You don't want to eat for about 4 hours before the infusion to minimize nausea, and then, of course, no driving for at least 4 to 6 hours after the infusion. The main side effects of ketamine therapy are generally nausea, which is a small number of people, like I said, about 7 to 10%, and it resolves shortly after the infusion stops. And so we use traditional antiemetics to prophylactically prevent this. Sometimes we use scopolamine patches or Antivert, so those are very helpful. And some people do get mild headaches that can be treated with just fluids, Gatorade, or Tylenol. Some people use N-acetylcysteine to prevent this type of mild headache. Of course, there's balance issues due to nystagmus. That's kind of a jiggling of the eyes. And that resolves within a few hours after the infusion stops. And then there's the anxiety during the infusions that sometimes occur. Individuals can a lot of times just kind of work through that. And this can be certainly controlled by either moderating the anxiety by just guiding the patient if they're uncomfortable, if they want to talk about it, slow the drip down, or even giving medication to kind of decrease the anxiety. But again, a small percentage of patients will complain of anxiety. And a lot of times we try to prepare the individual that it's okay to feel anxious and that you have something to learn when you feel anxious during a infusion rather than just blunting the feeling immediately. And the ketamine infusion is a time to confront those fears and take a look inward at things that worked and things that haven't worked in your life to deal with anxiety. And so it is important for the individual to recognize that anxiety can be really a positive thing during infusions because it represents areas of work that you can work on during ketamine infusions when your mind is a lot more flexible. Now, we also do monitor patients, and there can be mild heart rate and blood pressure changes. They resolve immediately after the infusion stops. And just to also note that ketamine is really out of your system within 30 minutes after you're done with the infusion. So good feelings that you have several hours later are due to actually changes occurring in neuroplasticity in your brain, not due to being buzzed on ketamine. So the initial infusion can be dripped over a longer period of time than 40 minutes, but generally the minimal effective dose that we give is zero point 0.5 milligrams per kilogram. And so we start at that dose and we work higher with each infusion subsequent so that the individual can kind of prepare themselves, for the subsequent infusions. And you don't need to be blasted into space the very first infusion. It doesn't make the process work any better. And also remember that you can control your own infusion. You can stop it or you can have it lengthened out to make you feel more comfortable. So you don't need to lose control. You don't need to dissociate. You don't need to have fear or panic. It's not necessary. And we kind of refer to the first infusion as feeling more like a moderate alcoholic intoxication with a steroid effect, effectively. So don't fear the infusion. It's something which, again, is completely controlled. And the moment the drip stops, the feelings and sensations stop. Now, every infusion will feel different, and it depends on the dose. So the earlier doses are 0.5 milligrams per kilogram, given over 40 minutes, but we go upwards to 1 to 1.2 milligrams per kilogram, dripped in over that same period of time or longer. And each infusion experience will be different, even at the same dose. Even after many, many, many infusions, individuals will describe times where they don't remember the infusion, or sometimes where they remember everything. So you can have amnesia or hyperamnesia, where you remember everything and almost feel like you didn't receive anything. And either of those are fine because you effectively still get the ketamine, you still get neuroplasticity, and you get improvement. And just recognize that your mindset certainly can affect the infusion experience, but sometimes even with a good mindset, you may end up not achieving or feeling, the same as you did in prior experiences. Generally, people are awake during their infusion. They can generally talk. And as the doses get higher, though, most individuals will want to be inward in their journey, and they don't want to be interrupted by staff or even family or anybody that's with them. And one other thing, again, dissociation is not necessary for ketamine therapy to work. You do not have to lose control. But you do want to recognize that with the ketamine experience, that the whole treatment process is nonlinear, that you will have times where you improve and times where you get worse during the treatment process. And so, again, there will be ups and downs, just like regular life. We have moodiness, we have an emotional baseline, and then we have ups and downs. But when you've been depressed a long time and you're feeling great for several sessions and suddenly you feel a little bit worse, again, the catastrophic side of our brain will fire off and make us feel like the whole thing is failing. So we tell people about this and to prepare for that. And these are things they need to talk about, especially if they have a difficult infusion. So initial infusions can produce calmness. They get spacey feelings and racing thoughts. Sometimes you can't really find words to describe the experience. It'd be like describing the taste of chicken, for example, or if you're blind, describing, having blue described to you. It's really hard to know what blue is because, again, these are just words. And a lot of people notice heaviness and numbness in their face and arms during the initial experience. And so this is part of the dissociation of ketamine. And there can be mild perceptual changes with visual distortions. And of course, moderate infusions start to increase mental imagery. You get insight, floating sensations, time distortions, inflated feelings, or stretching. Some will experience more synesthesia and connectedness to the world, to each other, and to God. They'll have spiritual journeys or sometimes religious journeys, and everything just feels connected. And then there's the mystical experiences, which also can occur, and understanding that life has meaning and that there's purpose in our lives and that we're part of something larger. And so a lot of individuals will have a blissful, euphoric mood experience. And at super high doses, some people will have ego death for those that want to go that direction. It's kind of like they're cleaning the cobwebs in their brain and kind of they're walking through their brain or just disappearing from themselves. And so what's really going on with psychedelics and ketamine as well is that you get increasing neural crosstalk in areas of the brain that generally don't speak together. So in a person who's normally just kind of thinking, we have key areas of the brain that connect together, but then there's areas that don't speak together so much. And so we get a crosstalk of information when you use psychedelics and ketamine therapy. So basically we exchange areas and information in our brain, increasing our cognitive flexibility, our psychological flexibility. And this is one of the benefits of the psychedelic experience and psychedelics in general is that exchange of information so that we decrease cognitive rigidity, kind of are able to think outside the box. And so we've kind of already referred to the dissociative, non-dissociative experiences and what they feel like. And everybody feels differently. They feel floating, connectedness, bizarre thoughts, shrinking and stretching and connectedness. But these are at higher doses. So the lower doses are just odd. Most people are finding that they're ineffable. They just can't find words for them. And the other question that people always have is, I need to dissociate, or do I need to dissociate for this to work? And there's been a number of studies, and they've kind of been all over the place as far as whether you need to dissociate to get response. But there's been meta-analysis and systematic reviews, such as this one, which demonstrate that dissociation is not necessary for effective ketamine therapy to work. And there's a lot of centers that are of the mind that you just have to make everybody be blasted into dissociation to have ketamine affect mood disorders, and that's not true. So effectively, in this particular study of Mathis and his group, they demonstrated that ketamine's dissociative and psychomimetic effects were correlated with depression changes only in 38% of the studies. So there's not much of a correlation. But for some individuals, they do find that dissociation seems to help them. So for those that kind of go that route, we can dissociate them and they seem to get response. So there is a subset of people that sometimes dissociation is the way to go. And these can be measured, dissociation can be measured through specific scales, such as the clinician-administered dissociative state scale and the brief psychiatric rating scale and a number of other consciousness rating scales. But again, those are just more for research purposes. And effectively then, just to put most people's minds at rest, your ketamine infusion experience is generally going to be one of just kind of bizarre feelings, but not dissociation. So loss of control isn't necessary. And what do you expect after the infusion? Well, we know you can't drive for at least 4 hours after the infusion due to balance and coordination. And also that your blood pressure and heart rate changes come back to normal pretty much immediately after the infusion is done. And nausea decreases within a half hour or so after the infusion is stopped, if you get any at all. And there are individuals who have insomnia the night of the infusion. It can certainly disrupt some sleep if it's given later in the day. But most people are able to work fine the next day. Some people do feel some fatigue that occurs, especially in women. You can exercise that day. You can do your routine activities later that day, so long as it's not driving or operating heavy machinery. And you certainly want to avoid marijuana and alcohol during the treatment process. But it's important to have movement, to get physically active and get in contact with nature and achieve an anti-inflammatory diet, avoid processed foods. So how rapidly does the ketamine treatment work? Some patients notice immediate effects. They feel calm, less sad, and fewer ruminations pretty much immediately after the first infusion. But most start noticing effectiveness around the third or fourth infusion. Every patient is different in their improvement, and improvement is nonlinear, as we mentioned. There are going to be ups and downs through the whole pre-treatment process. So you'll have a couple of times where you start to feel better and better and better, and then suddenly you have a bad experience. You feel worse the next day. And the problem with depression is that hot cognition it tends to be firing in overtime. The catastrophism side of our brain is, and the negative side is still there. And so that takes a toll on us whenever we start to feel a little bit worse. Even though we're feeling better than baseline, that drop from this feeling awesome basically makes our brain go in negative directions and patients will start to panic. And that's not necessary. Basically, again, I try to describe that this whole treatment is nonlinear. It doesn't matter what psychedelic therapy you get. It's not going to be a straight upward improvement. And infusion experiences can be happy, sad, or neutral. It doesn't really necessarily matter that you had a negative infusion. It's just what you do with that infusion. It's important to journal. It's important to meet up with your therapist and integrate your findings about what works and what didn't work and what feelings you had. And so again, a lot of individuals might not recall what they experienced during their infusion. That's one of the reasons why it's important to journal things. And we know that about 70% of patients will have response or remission by the end of the treatment series. And we measure these changes on traditionally validated systems such as the PHQ-9 or the Hamilton rating scale. But there are other things that improve in individuals that aren't so palpable. And these are kind of wellness parameters. And so we don't, score those out because it would be an endless amount of scoring. And that tends to be a little bit overwhelming to patients who are depressed. So what are the advantages of ketamine otherwise? Ketamine has a long track record of safety and efficacy, both in anesthetic use and in the treatment of mood disorders and subanesthetic dosing. Ketamine is the only medication that targets the glutamate system, the key neurotransmitter in the cerebral cortex. And also, ketamine results in synapse formation and synaptic plasticity or neuroplasticity, and it improves neural circuitry repair. Ketamine therapy is rapid and robust. It's highly effective for treatment-resistant depression and can produce remission or response within days to weeks in a significant number of patients, even if they failed numerous other antidepressant therapies, including even TMS and ECT in some cases. And we can basically prolong the effectiveness of ketamine therapy by using psychotherapy to integrate these results and to continue the improvement. Because again, we have the mood and then we have the behavior. And we can medicate mood, but behavior can't be medicated away. And therapy is important to really adjust the behaviors that have been accrued because of mood disorders and depression. And so we know that also ketamine can also be administered in a number of ways, and that it does have a short duration of psychedelic effects. So unlike psilocybin or MDMA, which can take hours to get through, ketamine can be administered and the person can be back up and running within the hour. And so again, ketamine is highly controllable. So other advantages of ketamine is that it produces psychedelic effects and ability to produce trance-like states and transformative states for a short period of time during the infusion, allowing for various degrees of altered states of consciousness with which a framework of wellness can be constructed for many individuals. And this journey of the mind allows the individual to decrease their cognitive rigidity, to consider new options of learning, and enhance their psychological flexibility and resilience. And so for patients that are stuck in their negative mood states, their low self-esteem and the glass is half empty type of negative self-talk, ruminations, circular thinking, the hamster wheel psychology type thoughts, and the getting stuck in therapy type individuals. Well, ketamine can break the shell of their default mode network so that they can consider new ideas in new directions. And neuroplasticity basically makes the mind a lot more malleable, makes it a lot more flexible in terms of its ability to consider new learning. And the other thing is that ketamine is available now. It's legal for the use for mental health and addiction disorders. And it's got a low side effect profile, with mainly nausea and dizziness being the side effects, in about 5 to 10%. That goes away quickly. As far as addiction risk, there's no true physiological withdrawal state from ketamine. Most individuals don't have cravings with ketamine use, and individuals who are abusing ketamine generally aren't the ones that are depressed. They're maybe partying with ketamine and other drugs in combination, generally not ketamine alone. So it's usually ketamine and cocaine and other substances that they're abusing, multiple substances in generally the context of parties and raves. And that said, again, certainly any substance can be misused or abused, but people can use ketamine for extended periods of time and stop it and not have any withdrawal from it, unlike coffee or sugar or even gambling or a number of other things that basically have problems with withdrawal or addiction risk. So the other issue with ketamine is that it can augment your traditional antidepressant therapy. So there are studies demonstrating that IV ketamine can augment the response to acetalopram, for example, or other antidepressants. And so when people are newly depressed and getting new treatment, using single or multiple doses of IV ketamine can make your antidepressants work faster and better. And the other thing about serial ketamine infusions is that ketamine also improves wellness factors that aren't affected by traditional medication. So ketamine improves calmness, energy, and happiness, and it decreases sadness and fatigue and worthlessness feelings, and also decreases worriness. And this is based on studies by Shiroma and his group using specific validated scoring. And again, in another format here, demonstrating how ketamine improves key indicators such as calmness, energy, and happiness, but decreases worriness, sadness, worthlessness, and feelings of fatigue and tiredness. And so again, ketamine affects wellness parameters and mental health states that really your traditional antidepressants actually have minimal impact on. So what about ketamine-assisted psychotherapy? Well, we offer CAP therapy in various options at Nova Health Recovery. And we do give preparatory sessions at the initial consult to kind of prepare the individual for their infusion journeys. Now, in-session sitting can certainly be performed at psycholytic doses, but most individuals don't really feel like talking a whole lot with ketamine therapies. There's not a whole lot to be gained necessarily with infusions with an individual sitting with you. Most of the work is done after the infusion or later that afternoon or the day after when your brain has increased neuroplasticity and cognitive flexibility. And most individuals are a little bit confused when they're getting their ketamine therapies and their memory might not be completely clear. So it is always best to do integrations after infusions. And a lot of people are confused about what CAP really means and what ketamine-assisted psychotherapy really means. That is, if somebody has to sit with you and talk to you during an infusion session. But the reality is that very few people want somebody with them because this is an inward journey. And if you even look at, for example, studies with psilocybin, MDMA, the individuals are mostly inward. They have eye masks on and they're listening to music, and occasionally they may come out and speak, but the most part it's an inward journey. And the most important part of CAP therapy is integration, which are therapy sessions after the treatment is done, later that day or the next few days later. This is where the importance of journaling what goes on during your sessions is important. Now, we can use home therapies also to help lubricate the individual's therapy sessions when they're stuck in therapy. And those could certainly be enhancing to kind of allow the person to discuss more of their problems with their therapist. But those are, again, are really, really microscopic doses. So how can ketamine therapy help integrate into a therapist's treatments? Well, patients generally are more open to approaching difficult conversations during CAP sessions, and they can also develop better strategies for coping, and that is certainly very helpful when the individual is having a hard time approaching certain conversations. And so CAP therapy can certainly be beneficial for that. And ketamine therapy helps with negative thoughts and ruminations and self-sabotaging behaviors. It allows the individual to step outside their behaviors to kind of see themselves for what's really going on. And they can then focus on more positive self-concepts and self-esteem issues. And goal setting begins to be easier with more positive and forward thinking. Behavioral activation can be emphasized. Motivation, increases, and so behavioral activation begins to be possible. And this also is allowed because fatigue decreases as well as you go through the ketamine process. It's also important for the individual to develop structured time. So the individuals who have just lots of downtime, who have taken time off work to heal themselves, basically have unstructured their time. And that puts them more in the default mode network. They tend to be less mindful and in the flow state where they're active. And so individuals who increase behavioral activation because of increased motivation and in the therapy sessions can basically improve themselves on a number of different fronts. Individuals also begin to be more open to new experiences, creative thinking, especially as their negative self-talk decreases. And so new coping skills are likely to be incorporated. Now, therapists can also help create a new learning experience as a result of increased cognitive flexibility that occurs from ketamine infusions. So therapy and ketamine treatments can certainly bring new perspectives to clients and direct them to see themselves in new ways. And this can allow them to also deal with trauma better and reprocess it in such a way that there's less self-blame and more forward thinking and less hyperarousal and fewer intrusive thoughts. And so briefly, for ketamine-assisted psychotherapy, we have the preparatory session to kind of help the individual explore goals and reflect on intentions for their sessions, set expectations, and define safety. And also helps them define the mindset. That's a critical component to address. Then you get the ketamine dosing and that in-session therapy session for some individuals, but most people will have their integration sessions after the ketamine dosing sessions. And what's important is that the integration helps individuals integrate positive outcomes as well as negative outcomes. And it allows this supplying of support for the individual's journey and integrate the insights and reinforce concepts of change that are valuable in this process. So again, ketamine is safe, it's effective, it's well tolerated. It's been in use since 1970. And when monitored medically in the office with subanesthetic dosing, we basically are following individuals' blood pressure, heart rate, oxygen saturations, but really these things don't change much at all. And so there's minimal impact on vital signs. Abuse and misuse of ketamine certainly can exist, but physiological withdrawal states are not present at medical dosing. And as a monitored prescribed medication, ketamine is very safe. And ketamine, as is used on the street, is basically frequently cut with other substances and used in certain contexts, such as party and raves, and generally used with cocaine and MDMA and fentanyl, and higher doses than is really used for subanesthetic dosing. Generally, they're getting anesthetic dosing. And so it's important to recognize that there's a difference between street use and office use. And the last thing is a return of depression, certainly can occur when an individual stops ketamine therapies, because the baseline natural neurobiology of depression is that there will be recurrences. So understand that if you're on ketamine therapies, that when you stop ketamine therapies without supplying other lifestyle changes and even other medications, that you may get a return of your depression. And it's important to have self-awareness and self-monitoring, just like weight loss. It's important to weigh yourself every day, and it's important to scale your thoughts and moods on a regular basis. And so after your initial series of treatments with Nova Health, for example, and a number of other places, we provide home-based oral and intranasal ketamine supplies for individuals for maintenance therapy. And they're done in prescriptive doses, and they're generally microdosed so that the individual's not having a journey. They're not really feeling anything palpably when they use these, but it's just designed to help maintain neuroplasticity. And individuals will need booster infusions, usually monthly, but you can come more frequently as needed. And so there are individuals that in the bad times of the year will come on a weekly or bi-weekly basis. And of course, ketamine-assisted psychotherapy, regular psychotherapy, lifestyle changes, addiction treatment, obesity treatment, medication changes, as well as integrative healthcare options are definitely important to be addressed, and we address them all at Nova Health. So what is the evidence that ketamine works? There's a lot of evidence out there. We're not going to go through all of this in detail, but as you can see, the early studies started with Berman and Crystal's group in 2000, and they took a small number of patients, 14, and demonstrated a single ketamine infusion resulted in significant improvement of depression scoring. And these were like really just a number of different treatment-resistant patients from all different walks of life. And there were studies that demonstrated this. The initial studies of Berman, Zarate in 2006, demonstrated that ketamine therapies worked. And again, what was neat about these particular studies is that they were dirty studies. They selected people who had suicidal ideation or had bipolar depression or treatment-resistant depression. They didn't exclude anybody. And so they demonstrated that in the most difficult groups of people, ketamine therapy worked. And most traditional antidepressant therapies will actually, when they get their FDA approval process, actually exclude patients who are suicidal or bipolar, for example. And then the studies go on from there. We can see Diaz de Granados and Moreau and Fava, and the list of studies go on. And again, the number of patients that were involved with each of these particular studies demonstrating efficacy for ketamine. And of course, meta-analysis, where they take a number of studies together to demonstrate efficacy of combined studies. Also showed that ketamine therapies worked for both patients who had suicidal ideation, individuals who had bipolar depression, people with treatment-resistant depression, and of course, they also looked at whether or not single dosing or multiple dosing of ketamine, or how many times a week ketamine should be supplied, also were evaluated in these studies. And each of these particular ones, demonstrated positive impact of ketamine in these various mood states. And so here we go, ketamine with bipolar depression treatment trials. and more ketamine therapy in bipolar depression treatment trials. And again, I'm not going to walk through each of these. I've worked through some of them in other videos, but some of them do include even sublingual ketamine for bipolar depression, using low-dose sublingual ketamine to help an individual improve their mood disorders. And IV ketamine has been shown numerous times to be more effective. But again, the effectiveness of ketamine therapy for everything from treatment-resistant depression and bipolar depression at subanesthetic dosing demonstrated robust and rapid effects. And then meta-analysis. After meta-analysis demonstrated efficacy of ketamine therapy. In these particular series, we see Sharoma and McGeer and McIntyre's group demonstrating again that multiple trials, when mixed together, continue to show positive impact of ketamine therapies on mood disorders. And as the list went on and on, obviously we get kind of this trend that, hey, ketamine therapies really do make a difference in individuals, but they are treatments, not cures. And so the real question is, how do we make this last? And, then the other question is, why do we do what we do? Why is it, 3 or 2 treatments per week in the dosings that we select? And we're going to discuss that here in a few moments. But we do know that based on meta-analysis from Hans group, for example, that ketamine has rapid and robust antidepressant effects. When they looked at multiple high-quality trials of some 368 patients, they demonstrated basically that there were rapid and robust response and remission rates in individuals within 24 hours. And that ketamine infusions can demonstrate consistent effects in depression. In one systematic review, some 28 studies with Marcanti's group demonstrated basically the efficacy and response rate of ketamine infusions in patients with treatment-resistant depression. Now, ketamine is also the ideal agent to help treat anhedonia, which is one of the most difficult paradigms to treat. People have no mood at all. They're not happy, they're not sad. But subanesthetic dosing of ketamine basically increases glutamatergic dopamine and dopaminergic signaling in prefrontal cortex areas of humans and rats. And that basically ketamine has been shown in numerous studies to basically affect anhedonia. And this is a state of actually depression where individuals have actually an increased risk of non-response, and it's also a side effect of traditional antidepressants. So ketamine is one of the most effective treatments for that as well. And then there's also the question of, how do we get response to improve and how to make it last longer? And with Moreau's group in 2012, they demonstrated that we can get more rapid and longer term antidepressant effects by repeat dosing of ketamine infusions. And so this is where we start to get the series of 6 infusions, and that the response rate was a lot longer when you gave longer doses of ketamine. And we have further studies demonstrating that repeat and longer term antidepressant effects of ketamine work best when there's repeated dosing. And we have Zheng's group and Sharoma's group and Singh, as well as Phillips, demonstrating that multiple infusions work better. And again, we looking at Phillips' group here in more detail, that effectively that the series of 6 infusions lasted longer with their antidepressant effects and increased the overall response rate in individuals with severe depression. And what dose of ketamine works best for depression? And so there's a number of trials that have been out there looking for dose ranging effects of IV ketamine, and one of the best is Fava's group, which effectively, through a series of assigning individuals in a multi-arm fashion, demonstrated that there's efficacy between the 0.5 to 1 milligram per kilogram subanesthetic IV ketamine dosing, and that somewhere in between that range that we had the best response, but lower than that there was not response. And so just kind of in a visual format here, ketamine rapidly affected response rates. It improved response quickly. And somewhere between this 0.5 milligram to 1 milligram dosing, this was significant as far as its antidepressant effects over several days, whereas Versed, which was the comparison group, and lower dose ketamine groups did not significantly wash out. So this is where they get the zero point 0.5 to 1 milligram per kilogram IV dosing. And Fava's group demonstrated this through 99 patients in this multi-armed trial. And then there's also about the dose escalation. So we at Nova Health generally start at the lower dose and escalate each dose to improve response. And in this study with Cousin and his colleagues, they effectively escalated the dosing over several infusions and demonstrated increased response by doing so. And their dosing responses were over the range of 0.5 to 0.75 milligrams per kilogram over 45 minutes for their ketamine infusions. And that basically some 41% responded and 16% of patients remitted in their series. And their initial group of patients was 14 patients. And escalating ketamine doses also works best in decreasing suicidality. And this was a study with Calabresi in 2019 where they used 6 serial infusions and noted that the best treatment response was by escalating the dose over to 0.75 milligrams per kilogram, but they used a dose range of 0.5 to 1.2 milligram per kilogram over 40 to 50 minutes. And so we found the same thing clinically at Nova Health Recovery, that escalating the doses between that range over the series of infusions allows a more controlled infusion experience and also seems to improve outcomes rather than just maximizing the dose on day one. And so the best doses are in this range, 0.5 to 1 milligram per kilogram over 40 minutes. And we start at the lower dose, the therapeutic dose, based on ideal body weight. And we recommend that the person get 2 to 3 infusions per week, generally non-consecutively, for depression and mood. And most individuals do best with a series of 6 infusions. Improvements are started to note it around the 4th infusion. And so again, as far as the decision for 2 or 3 infusions per week, based on a study from Singh in 2016, they effectively took 68 randomized patients and evaluated whether 2 or 3 infusions per week made a difference in terms of treatment-resistant depression response. And effectively, they found that they were about the same. And so you could do 2 infusions per week or 3 infusions per week. However, it seems that just from a clinical perspective, the 3 infusions per week seem to work best in individuals. There seems to be more of a downward trend in individuals who only go twice per week. But according to the medical-based evidence, you can certainly do 2 infusions per week. Now, the last benefits of ketamine have to do with suicide and suicide risk. And we know that suicidality is unfortunately a huge problem, and it's a huge impact on mental health. And some 700,000 people worldwide die annually from suicide. And 10 to 20 times this number attempt suicide yearly. And suicidality is really very difficult to treat. There are no medications that work extremely well for decreasing suicidal attempt, but FDA-approved medications currently include clozapine and lithium. But ketamine does have significant impact. And I did fail to mention ECT. ECT has also been proven to work for suicidal ideation. And we do need rapid-acting treatments for suicidality. You know, antidepressants can certainly be effective, but they take weeks to work, and it may require several treatments of antidepressants to figure out which one makes the person less suicidal. And antidepressants do not work well for bipolar depression. And a lot of patients with bipolar depression have an increased risk of suicidal ideation and suicidal attempts. In fact, it's one of the highest risk mood disorders for active and completed suicide. And so there's very few treatments available for suicidal ideations, as we mentioned, and psychotherapy may take weeks to work. And so these individuals need rapid interventions. And so it's been shown through a number of studies. We have studies by Ionescu and Phillips and Zhang and Moreau and Grunebaum, and some of these are kind of mentioned earlier, that basically ketamine therapies rapidly reduce suicidal thoughts and major depression. And that there's a number of other studies out there as well that demonstrated rapid improvement in suicidal ideation in patients with bipolar depression and treatment-resistant depression, and a number of different mood disorders. And here's just a sampling of some of them. And so ketamine does have robust data for rapid reduction of suicidal ideation, and that the anti-suicidal effects of ketamine are different than the antidepressant effects. They're separable, actually. And it's certainly a consideration for early use as other treatments are incorporated. And it's safe and effective. And it's been used in patients who have bipolar depression. And there are ongoing studies to evaluate this therapy, but not all patients respond the same to this treatment. And also, there will be a requirement for maintenance infusions. And it seems to also have better efficacy with repeated ketamine infusions. So the last thing is the strategies to produce or to prolong ketamine's efficacy. And basically, the only way to prolong ketamine's efficacy for treatment-resistant depression is through repeat ketamine infusions, unfortunately. So all lifestyle changes taken into effect and all possible treatments, medications, through a general review with McMullen and his group, basically was that the best strategy to prolong ketamine's efficacy is actually with repeat infusions. And so taking 454 articles, they included 22 articles with 10 randomized controlled trials and 8 prospective open label trials and a number of other case reports. Basically, they were only able to, in this study with McMullen and his group, to demonstrate that repeat IV ketamine was the only effective strategy to prolong the efficacy of ketamine's antidepressant effects. And basically that using ketamine on long-term basis seems to be safe based on a number of studies, but Wilkinson mentioned this in her study in which basically 54 patients who received ketamine infusions at her institution with a total of 518 total infusions, they demonstrated improvement in mood and depression and also safety and efficacy. But there are other ways to provide ketamine on a maintenance basis in the home front, and this is something which we do in Nova Health Recovery, is using home-based oral ketamine and intranasal ketamine to basically maintain the efficacy of ketamine infusions and decrease the need for infusions as well. And there's a number of studies demonstrating efficacy of oral ketamine in depression as randomized controlled trials from patients who haven't received IV ketamine initially, but oral ketamine in and of itself takes longer to work if you don't get infusions, so it could take several weeks for it to work. And so we do find that home oral ketamine can maintain effectiveness after IV ketamine infusions, and we've certainly found that on a clinical basis as well. And there's quite a few trials that are being worked on currently to maximize the home-based use of ketamine. But of course, some of the key points for maintenance therapy is actually psychotherapy. It's very important for therapists to be involved with the continuation of care and that the person look at traditional treatments as well and maybe even new diagnosis. So a lot of patients with treatment-resistant depression may have bipolar depression or other types of mixed features. And there are newer medications coming out currently that may be of value in those individuals. And of course, there's other medical issues and even integrative medical health issues that should be addressed as well in these individuals. Last slide on this is what's better, Spravato or IV ketamine? And a lot of people have done Spravato, and that's the S-ketamine done in the office setting. It's the FDA-approved version of ketamine. And then there's IV ketamine, which is 50-50 mix of R and S ketamine, and that's what we're providing. And there was a meta-analysis, systematic review done by Bahi and his group, and this was recently released in 2021, which basically took 24 trials, some 1,800 subjects, and they compared IV ketamine to Spravato, and they demonstrated a robust effect and more significant effect using IV ketamine versus Spravato. So the relative rate of IV ketamine working in treatment-resistant patients was 3 versus the relative rate of 1.3 for Spravato. And that was response. And as far as remission of depression, IV ketamine was even more effective. And so basically, we get remission rates and also higher response rates with IV ketamine, as well as fewer dropouts. So basically, people on Spravato tend to drop out at higher rates than IV ketamine. So if you have any further questions or if you're interested in ketamine therapy, certainly go to the website Nova Health Recovery. Our website looks sort of like that. We also offer ketamine-assisted psychotherapy, and also we allow therapists to be engaged in their patient care with integration at Nova Health Recovery. And there's also a newsletter which can be obtained through actually this barcode, this QR scan code, which you're more than welcome to use. And then we usually post new articles and other information on that as well.